Hi everyone, good afternoon. My name is Caitlin Schneider and I'm the Partnerships Director with United Way of Salt Lake. And I'm here today to talk to you a little bit about Utah 211. So the goal of today, hopefully, is that, or whenever you're watching this, that you get kind of an overview of what 211 is, some knowledge of the resources that are available through 211, and a really good understanding of how to connect to the services that we can provide. And there's a multitude of different ways to do that. So that's kind of the things that we're going to walk through during this presentation. But I first wanted to start with just kind of giving you an overview of what Utah 211 is. So this is our vision statement. And so for Utah, we really envision a 211 system that helps ensure every person in the state has their basic needs met. So things like shelter, clothing, food, access to appropriate health care, and personal safety, among many others. But we really see ourselves as that connection to those basic human resources to ensure that people can live their best lives. To do that, we really serve what we consider three different kind of populations. So the first one's probably the most obvious, but the people who are directly needing the services that are in our database that we're going to talk about. But for those of you, especially in school settings that are really directly involved with the people who might need that help. So we want to be a resource for all of you. We want to be partners with you and really make sure that you know the tools and the resources that are available so that you can also best help the individuals and families that you're working with. And then the last group there is people who make policy and give funding decisions for services used by those who might need help. So 211 collects a lot of data. We'll talk a little bit about some of that, show you the resources that you can access with some of that data. But we really want to use that data in a beneficial way to make sure that the state and policymakers know kind of what's going on, what the needs are, and how they can better target their services to the folks that need the help throughout the state of Utah. So just some general kind of things around the 211 helpline. All of our services are completely free. They are confidential. We are available 24/7, which is a really nice feature. Not all of the ways that you can access 211 are available 24/7, but there is always someone that you can call if you dial 211, the 3-digit number. Somebody is always available 24/7. Some of our other contact features that we'll talk about, like chat or email or things like that, may not be available, and someone will respond during our normal business hours. But for the most part, some resource for 211 is available 24/7. It's really all the local resources in Utah in one location. So something that's really cool about 211 here in Utah is that we are a unified state system. So what that really means is that we do have multiple locations. We have 2 call centers. One is located in Salt Lake City at the United Way of Salt Lake office. And our second call center is located down in Provo at the United Way of Utah County. But we all access the same resource database. We use the same phone systems. So really, no matter where anybody calls in from across the state, they get the same kind of services and experience. Whereas in other states, sometimes the 211s are disjointed. They might be, for example, California, there's a 211 Los Angeles, there's a 211 San Diego, and their databases and things are separate and they don't really work together. But here in Utah, we are one state system, so it's really great that we can partner in that way. We can provide services in over 200 languages. Most of our staff that's on the phones are bilingual in English and Spanish for a really easy assistance with services, but for other languages throughout the state, we can use and access a language line to help those individuals as well. So we don't want to discourage people from reaching out to us even if English or Spanish isn't their primary language. And then something that people don't always know about 211 is that we do follow up with our clients. So this isn't required. Again, people can remain completely anonymous if they'd like to. We honor that. If they want someone from 211, though, to follow up with them, we will just ask for some basic information, like their name and their best contact, whether that's their phone number or an email or something like that, because we want to offer that service to make sure that whatever resources and referrals we provide to them, that they're able to get connected. So we offer that follow-up to just say, you know, hey, can I reach back out to you in maybe 3 to 4 days and just make sure that the resources I'm providing to you today work out for you. And if they don't, we can use that follow-up opportunity to either apply additional resource to them or be able to kind of move on to another need that maybe they're dealing with after they got their first need met. So that's something that we do offer to the clients to make sure that they're getting connected. A couple other just kind of facts about 211. We really do want to provide great customer service, and so to try to do that, we will provide warm transfers over directly to the service providers. We want the individuals to maintain kind of that choice of where they'd like to be best connected to, but we will warm transfer them over to a provider of their choice if they'd like to get connected right away. And then something we just always want to make people aware of is that 211 is not a suicide line or a crisis line, but we do often tend to get some calls like that, and so we do have partnerships in place with the University Neuropsychiatric Institute up at the University of Utah and the Addiction Resource Center for folks that may be needing more intense kind of crisis guidance or help in that way. So we do partner with those agencies to make sure that they get connected to the help that they need if those things come up in conversation. I touched on this a little bit, but just wanted to make you all aware that 211 is a national platform and a national phone number that was established. And so most of the United States is covered by a 211. You can kind of see there's a few pockets in states, Illinois and Arkansas being a couple states that don't have much coverage for 211. But Utah is fully covered, as I mentioned, by our 2 call centers. And if you're ever, interacting with someone or dealing with a family who's maybe struggling with other family members that are living outside of Utah, or you're in a part of the state that's really close to a border, 211.org is the website that you can go to find out how to get best connected to the 211 for that area. So for example, the way that the calling system works is that if someone dials 211, it's gonna use the cell phone towers to connect them to their closest call center. But sometimes things just get crossed, and we'll get calls from people who are in Texas or New York. It just happens sometimes, and so we actually do use the 211.org website as well to then search by zip code or by state to find out what the 800 number is for the 211 for that person's area. So that's just a resource for all of you. Digging back in to Utah a little bit, so this is kind of an overview of what's in our 211 database. So you can see some numbers here. Our total providers, these numbers tend to fluctuate a little bit, but about 2,700 total providers, meaning different organizations, are listed in the 211 database throughout Utah. And those providers provide almost 9,700 different services. And when we walk through kind of the website where you can see the database, I'll explain a little bit more about what that means. But essentially, it's a very vast database of resources for all different types of needs throughout the state of Utah. This is kind of the protocol that we follow for those database resources. So primarily, we include government or nonprofit services throughout the state. Sometimes we'll include specialized services that maybe don't fit into that government or nonprofit sector, but maybe they're the only service in their area, especially in rural parts of the state. We also include some faith-based and organizations that provide services on a sliding scale. You see some asterisks there around substance use disorder resources, and I just want to touch on that for a minute. We partnered with the Department of Health at the state level about a year ago now to become the designated substance use disorder helpline for the state of Utah. So because of that partnership, we wanted to make the substance use resources that are available in our database a little more comprehensive. We had resources in our database before, but really they fit into those government and nonprofit offering services on a sliding scale type resources, and we've expanded that out a little further. So there's just a little bit of a disclaimer that not all of the substance use disorder resources are government or nonprofit. We do have some for-profit in there, and those that maybe take private insurance, things like that. But that's really in an effort to try to make one comprehensive database for the state of Utah around substance use disorder resources. And I'll show you that section on our website here in a minute as well. Some of the common needs that we often come across that people are connecting with 211 for, you can see kind of the three main buckets there is things like healthcare, housing, so things like rent payment assistance, looking for low-income housing. Utilities is another big one, especially in the wintertime. We connect a lot of people to heat assistance programs if they're having trouble paying for their utility bills, and of course food resources. Again, really those kind of basic need categories. But I'll pull up this other slide here that just shows you that that's not all that we do. So there is a ton of different things in our database. I'm not going to read these all to you or go over any of them in detail, but you can just see there's definitely a diversity in the types of needs that people are calling about, and that we have resources in our database to help guide them to. So it's a lot of different things. This slide, I just want to highlight a couple of the kind of key partnerships that Utah 211 works with. So the first one you see there is Utah Tax Help. So during this time of year, from January to about April, we do help schedule appointments for Utah Tax Help, or the VITA program. You might have heard it called that. So it's really free tax assistance for low-income individuals. So we encourage people to call 211 or go to utahtaxhelp.org, and they can schedule their own appointments there. But it's a great service to hopefully help people get their taxes prepared at no cost if they qualify. The middle one there is Take Care Utah, and hopefully everyone has heard of them, but if you have not, Take Care Utah is the statewide partnership of healthcare navigators, so the folks that can help families and individuals enroll for things like CHIP, Medicaid, Medicare, the Affordable Care Act, insurance programs. So they're a really great partner, and people can always reach out to 211 as well, and we'll get them connected to their closest navigator. And then the last one up there is Help Me Grow. So Help Me Grow specifically works with families that have children under the age of 8, which could apply to many of you, I'm sure. And they really do similar services to 211 in that they connect families to resources, but they also do a lot more kind of ongoing follow-up and connection with families that are maybe just having some concerns about the development of their child, or just having questions about parenting in general, child care, all of that good stuff. So you can also get connected to them through 211. And we have many, many more partnerships in like the health arena and in other ways, but I thought those were maybe some good ones to highlight for this group. We're moving now into kind of how to access 211, and I just wanted to pull up this slide to show you that over time our interactions with people have really changed as technology has kind of changed. So you can see here really our calls, chats, and emails, those direct interactions have kind of declined over the years. And we're really seeing an uptick in our website sessions and our app searches. And I'm going to walk you through both of those resources because they are really nice. You can access everything that's in our database on your own, which is really, really cool. But there's also, still value in reaching out and knowing that 211 is always there to help walk people through whatever they might be needing. We often find, even when people call into 211, that sometimes they don't really know what they're looking for. And our information specialists are really, really skilled at asking good questions and best figuring out what their primary needs are and how we can best connect them to services. So just wanted to highlight that, which leads us into all of the different ways that people can connect with 211. So you can see there, the first one, obviously, they can just dial 211. It's the simplest and easiest to remember, probably. But our 800 number is listed there as well. I'm going to show you more in detail the website here in a moment, which is 211utah.org. We also are going to talk about the app here in a little bit, and that's free to download. You can find it easily by just searching 211 Utah. Clients also have the ability to text us. So what they do is just text their zip code to 898-211. You can see the number up there. And we can interact with them via text, which is fun. They can also email us, and then our social media platforms are listed there as well. The one caveat I will say to the social media platforms is we will respond to folks that are looking for services via those methods, but it's not our preferred. We would really prefer that people reach out in one of the other ways, just because we have more secure kind of control over the data that's submitted through like the texting or calling, obviously, or emailing us, whereas with social media, that could be a lot of information that people are sharing over something like Facebook. And so we want to try to avoid those, but we use those platforms to really put out messaging about events in the community, updates about the providers that we're working with, specific partnerships or resources that the community might be interested in or that providers might be interested in. So we use those platforms more for that and less for direct interactions with clients that are looking for assistance. Okay, so now we're moving into some of the specific resources. So I'm going to show you just a couple slides here about our website, and then I'm actually going to switch over to our website and show you, kind of walk through it with you. So again, the website is 211utah.org. You can see a screenshot there. So right on the home page, you can see the different categories of services that are kind of broken down. You can search by clicking into those categories, or right where it says help starts here, folks can enter a zip code or choose their county to start looking for resources based on that. And we'll walk through that here in a moment. The other thing I'm going to show you on the website is that you do have the ability to create an account. What's really cool about that is it's totally free. You essentially just go in, create a username, a password with an email address, and then anybody can have their own free account to the 211 website. And what that can allow you to do is actually create your own resource groups. So if you're someone who's directly working with individuals and families, and you're finding that you're going maybe to our website often and looking for the same types of resources, whether that's food or healthcare, substance abuse, whatever it is, you can actually kind of create that account and save those resources to different resource group lists. And I'll show you more of how to do that. But that's a really nice way so that you're not always going back and searching for information. You can kind of have those resource lists already created and managed in the way that works best for you. And then this slide just kind of shows a highlight of what a provider listing looks like in our database. So you can see here, this was for Help Me Grow. It shows the basic contact information. It shows all of the services that agency provides. And you can click into each one of those tabs for more information about things like eligibility, required paperwork, hours, direct phone numbers for that program, things like that. And then on the website as well, you can actually email, text, or even print off a specific resource, which is pretty cool. And sometimes we even use that feature with callers. Maybe they're calling us from their car, we want to share a resource with them as a referral, we can use like that text or that email option to send it directly to them so that they're not having to worry about writing any of the information down. We can just directly send it to them and they can follow up when they have a moment. So before I switch over to the app, I'm actually going to come out here and show you and kind of walk you through our website. So here it is again. Again, the website is 211utah.org. And as I scroll down here, you'll kind of see what you saw from my screenshot, but the main services are kind of broken up into these larger categories. So housing, utilities, food, transportation, legal, mental health and addictions, medical, dental, vision, employment, education and training, domestic violence. We have a special category. This kind of tends to rotate throughout the year. Right now there's wintertime services. In the summer there'll be like special summer programs. So it's just that section gets updated as needed. And then down here there's also a custom search topic. So if, searching by the main categories, you're not quite sure where the resource or the need fits that you're looking for, you can just use that general custom search down here, if that works better for you. So I'll go in real quick and show you, I mentioned the substance use disorder resources. So when you click on mental health and addictions, you can see then how each of our resources are broken down into further subcategories. So even under mental health, there's several different breakdowns of resources available there. But at the very bottom here, there is a substance use disorder resources section. And you can see there that's then further broken up into things like detox, outpatient, inpatient, support groups, harm reduction, crisis. So it's a really, really cool tool available there, specifically for substance abuse. So I'm going to go back to the home page here and just show you, for example, if I click on food, and then maybe I'm most interested in food pantries and food box programs, so I can click into that subcategory. What's nice is up here at the top, you kind of have some additional filters or search criteria that you can include so that you're not seeing all of them in our database, especially because this is statewide. So for example, if I just want to see in my zip code or in the zip code of the person that I'm trying to assist, what are some of the resources? So for example, if I'm here in downtown Salt Lake, I can enter the zip code there and then click list by location. And now it's going to reorder the search results here so that I can just see the ones that are closest to where I am, which is really nice. And if I click into one of the services, I'm just going to pick Crossroads as an example. You can see here again kind of the screenshot of what I showed earlier, but it shows like the basic contact information, their address, their phone number, their website. It shows me a map of where they're located. It gives me kind of this general section. So if I expand that, I can see a description of the organization, their hours, other related resources, the last date that this was updated, some contact information. For them, they have quite a few because they have quite a few programs. And then here, all of these different blue kind of boxes are the services that they provide. So Crossroads is a good example. There's a lot of different services they provide, like bus fares, clothing vouchers, diapers, food pantry, formula, baby food, gas money, utility service payment assistance. So there's a lot of things, but I was initially looking for food, so if I expand the food pantry service, it tells me kind of a description of what they offer, their hours again, required documents I would need to bring, what the eligibility requirements are, if there's any costs, languages served, geography served. So there's a ton of information that can be found in here, which is really cool. And again, at the bottom here, if I wanted to email, text this to my phone or another person's phone, or even print off this resource, those options are available there. The other thing I mentioned during the presentation as an overview is that if I wanted to save this resource for later, you can actually go right here. So if I had never created an account, I could create a free account right here. If you have created an account before, which I have an example one I can show you, is I would go up here to my account. So again, from this page, you could create an account directly from the home page. I'm just going to log in so that you guys can kind of see what this looks like. And then I can go over to manage my resource groups. So I've just kind of thrown some in as an example. I was able to create the group kind of name that I wanted for each of these. So I have one for food pantries, legal services, substance abuse, domestic violence. From this page, you can create a new group and then go in and add those resources as you're using them or as you're working with families and you know that certain needs are coming up over and over again. This is, again, just kind of a great way to have your resource list kind of prepared, and it's really easy then to search for something rather than having to go back through the initial search process. So that is a resource that is available to you. A couple other things, I'll just kind of orient you to the website. Up under here where it says About Us, there's a couple different tabs. The one I want to show you is called Our Work. So if I click in there, this is where a lot of our data lives and is kind of live, and you can really explore some different filters and things to see what the needs are in your area. And so in here, this kind of, you can search by different needs. You can search by county, city, zip code. If you're really particularly interested in a certain age range, race or ethnicity, there's a ton of different filters that you can apply to this. So for example, if I was really interested in who in the state of Utah is needing food resources, I could come up here, I could change the need category to just food and meals. I'm not going to do that at the moment, but I could, and then it's going to update all of this demographic information down here. So without changing any filters, this is just for all contacts with 211. We ask them if this was their first time contacting us. You can see that's about 50-50. Are any adults in the household currently looking for work? Are you currently receiving government assistance? About 61% already are. Does anyone in the household have a disability? About 39%. Do they have children under the age of 18? Again, it's about 50-50 for our contacts. And then you can see kind of the breakdown of race, ethnicity, annual household income, household composition, and highest level of education. So there's really cool data and fields that you can play with here. Again, you could search just by your county, your zip code, your city to see this. You can also go back up here and just go to the top 10 service needs by demographic. So if I click into there, it's going to load the next page, and there's a lot of data that lives in here, so sometimes it takes it a moment. But again, without changing any filters, this will just show the top 10 service needs and the top 10 zip codes that we receive contacts from. So you can see the overwhelming top need is utility service payment assistance, followed by food pantries, the VITA program, again, the tax program that I mentioned, rent payment assistance, rental housing, dentistry, holiday gifts and toys, homeless shelters, navigator programs, and specialized information and referral. So there's really cool things that you can kind of play around with on the website. And if you're playing around and you still want more data or more specific data, you can always reach out to us and we can connect you to that. The other cool thing I'll show you under resources is we do have county resource lists, and they're available in English and Spanish. What's nice about these is that they are kind of pre-crafted and ready to go. So for example, under Salt Lake or some of the other highly populated counties like Utah County here, we have multiple resource lists just because they would be super long if we only had one for the entire county. So we break them down into some subcategories, but they're kind of nice. You could click and look. Let's look at food, for example. And this was just updated last year, and it kind of just gives all of the food pantries in Salt Lake County, their address, their phone number. So it's not as extensive of information as you can find in the full listing. And the other caveat to this is oftentimes as soon as we update these resource lists, something will change. So that's why we really encourage people who are using this a lot to go in, create their own account, and you can have those resources saved, and they will always be the most accurate and up-to-date services rather than these kind of pre-populated resource lists. But we do realize, and that's why we continue to update these and create these, is that they are really helpful for people, that they can have something kind of quick and easy they can print off and hand to someone. So they are here and available under resources. And again, they're also available in Spanish right there. The other quick thing I'll point you to is our partners page. This is just where you can find contact information if you're looking for more details about our inclusion-exclusion policy, regarding our database and being included in the database, applying to be a partner with us, or requesting materials. So again, this is, I'll share my contact information again at the end, but if you wanted to request a presentation or outreach, you can click right there. If you want to request hard copy materials such as flyers or things like that, you can click here and email us. So there's a lot of great resources on the website. With that, I'm going to switch back over here to the presentation. And I know that we have a chat box here too, so if you have questions as we go, please feel free to chat in and ask those questions, and I'll do my best to answer them. But just as we kind of get close to wrapping up here, I wanted to talk about our app, because this is kind of our newest resource for individuals to connect with 211 and find those services pretty accessibly. So again, you can just find it on Android or in the App Store through Apple by searching Utah 211. It'll pop up. And I have some screenshots here to kind of walk you through how the app works. But you'll see and notice right away it looks very similar to our website. It's organized in a very similar fashion. And again, it includes all of the database resources throughout the state of Utah that we have. So this is a screenshot of the homepage of the app. Right up at the top in the right-hand corner, you can see that right now it's showing that the county it's searching in is Utah County. If you click up there, you can change the search area, and that'll bring you to a page that looks like this. So you can use your phone's current location by just using that little button that says use phone location. You can search by a different city or zip code, so especially if you're working with a family or someone else who maybe lives in a different part, you can set a different location, or you can click the box at the bottom there that says search the full state of Utah. So if you want to see everything throughout Utah regarding a certain service type, you can do that as well. So there's multiple different ways you can search. And then there is a couple different ways too that you can navigate through the resources. So again, similar to the website, you can click into these kind of broader categories that are showing here, or in that middle search bar up at the top, you could do a custom search if you'd like to as well. But I'm just going to show you what the category search looks like. So again, here we could click into family support. When I do that, there's a couple different options of how it can list out the resources. So again, it can sort them by distance, which is what it's doing now. It can sort them in alphabetical order with that middle column that says ABCs. Or I can further search into some subcategories under family support, which is what you see there on the right. So for this, I wanted to just show an example of, if somebody's having a concern with parenting resources, you could go in and click on parenting. That will then bring them to another list, and it's just showing resources specific to parenting. Again, I'm going to click into Help Me Grow. And you'll see here when you open it in the app, it looks, again, very similar to the website. So again, it shows basic contact information, description of services, telephone numbers, the individual services that are offered, things like their hours, required documents, eligibility, fees, languages, all of the same good stuff that's on our website as well, right there in the app. There is a way in the app too that you can share the resources. So again, right up there in the top right corner, you can share it. And if you click that, you will see the couple options pop up through this where you can share it via email or share it via text, just like you could on the website. If I go back one slide too, right next to the share button, there is a favorite button. So again, if you're accessing kind of the same things a lot of the times, it might be nice to just favorite the resource so that you have quicker access to it. So you can click that, make it a favorite, and then even from the home page of the app, you can click your favorites right there and access any of the resources that you've noted that you wanted to favorite it. The difference with the app compared to the website is that you can't make like categorized groups for your favorites. That may be a feature that comes eventually, but right now the app can't do that. It's just one list of all of your favorites. But still can be really helpful. So you can see here, once we added Help Me Grow, it's now listed there under my favorites. What's cool about the app too is you can actually print your favorites list as well. So you can see up there, there's a little printer icon, and you can print and share your favorites list directly from your phone. And kind of the last little resource I'll provide or show you here for the app is that that little kind of the hamburger icon, if you will, or the menu icon in the top left. If you click on that, you can open up additional resources or help. So again, that top one there, if you're looking on the app and you're just not finding what you were hoping to, there's a button there you can click, right, to talk to a 211 specialist. You can text a 211 specialist. You can search for volunteer opportunities, change your location, access those resource lists that I showed you on the website, or there's a help button there too. So that's kind of the brief overview of the app. And then just to wrap up here before maybe we take some questions, just what staff at 211 want you to know, no matter how you connect with us, whether that's through text or email, by calling, we want you to know that you'll be connected with an empathetic and compassionate individual that's been highly trained in information and referral services. They're there to listen and support individuals when they're most in need. And sometimes those needs and challenges are really difficult to walk through. And so they can listen and provide the most appropriate resource information so they can connect to the help that they need. And even though I've showed you a lot of ways that you can access the resources in our database on your own, you don't have to do this alone. Information specialists and all of us at 211 are there to help, to answer questions, to partner with you, and to provide ongoing kind of training, technical assistance, resource materials, whatever that looks like or whatever your needs are. So with that, this is my contact information. Again, I'm at our United Way of Salt Lake office, but if you're in the southern half of the state that our Utah County colleagues cover, I can certainly get you connected with them as well. But we, again, are here as a resource for all of you. If you're wanting additional training for your school, your staff, you want outreach materials to have on hand to provide to families, please do reach out to us. We're happy to do that and to connect with you, to answer questions and troubleshoot any problems that you might be having. So again, that is my contact information. And if there's any questions, please type them into the chat box. Give it a minute here to see if any come through. If not, again, I hope that if you're watching this live or if you're watching kind of the recording afterwards, please don't hesitate to reach out to us if you do have questions or concerns for the families that you might be working with, and we'll do our best to help in whatever ways we can. Okay. we're not seeing any questions, so we're going to go ahead and wrap up, I think, here. But thank you so much, and have a great day.